Okay, so I'm going to go ahead and get started. Um, this is Claire McFadden. I'm the director of the Developmental Disability Services Division, and we're having a webinar to orient new members who've joined work groups on the Developmental Disability Services payment reform. There were a few more invitees that have not signed on yet, and that said that they might sign on, so we may get a few more people. But in any case, I just wanted to let folks know that I am recording this webinar because there's a few members who couldn't make this time slot, and I'm going to make it available just for them after this meeting. So, why don't we go around and say who we are that's on the phone? And if you could just say your name and who you represent, like if you work for an agency or an organization, and which work group you're going to be on. So why don't we start with Beth?
Can you hear me?
Yep.
Okay, my name is Beth Masters, and I'm the parent of a developmentally disabled young adult, and I work on the Assessment Needs Tool work group.
Great, thanks. And Denise?
Hi, this is Denise Smith. I'm the business manager for specialized community care, and I'm on the Encounter Data group.
Great, thanks. Kaya?
Hi, I'm Kaya Andrews. I'm a parent with a disability, and I have a child with a disability, and I work with Vermont Developmental Disability Council.
Great, thank you. And Sherry? So Sherry, if you could unmute yourself, and we're just asking people to say what their name is, who you represent, and which work group you're on.
Good morning, Claire. It's Sherry Thrall from Lincoln Street. I'm on Encounter Data.
Great. Let's see. Did we get anybody else that I forgot? Oh, Stephen Raw. I'm not sure I'm saying your name right.
I pronounce my last name Rao.
Rao. Okay, thank you.
Rao. And I'm a member of the Payment Models group, and I'm a parent of a 45-year-old son who has developmental disabilities.
Great. Okay, so that's everybody we have today so far. If anyone else joins, we'll have them introduce themselves. So, just going through how the webinar will work. At certain key points after some slides, I'll stop and ask if people have questions. I think right now, because there aren't that many people on the call, I'll just you don't need to mute your line. But if there's a lot of background noise, I might mute people, and then I'm able to do that from my end, and then I'll unmute folks. I am recording this for people who weren't able to attend, and I'll have that. And let's see. Okay, so we may as well get started. So this Developmental Disability Services Payment Reform is a very significant initiative that the division and the department are engaged in, and we are looking to create a more transparent, effective, accountable, and administratable payment model that aligns with our Agency of Human Services payment reform and healthcare reform goals. So in thinking about what all those words might mean, transparent.
Hello. Hello, this is Chris Wallhoff joining the meeting.
I'm sorry, could you say your name again?
Chris Wallhoff.
Oh, thank you, Chris. Can you just say who you are and which work group you're in?
Yes, I'm Chris Wallhoff. I am the parent of an adult autistic child, and I am joining, I guess, it's the Payment Reform Initiative webinar. I don't know which group I am in. I probably should. Let's see. I am with Stefan Rowe, and Heather Kent.
Yep.
In that group.
Yep, you're in the payment model work group. Yep.
Okay, payment model. Okay.
Thanks for joining us.
Okay. No problem.
Okay.
And I live in the suburbs of Newport. If that helps.
Great, thank you. So, going back to this slide, transparent. We want to make the system that we have in place very transparent, which means we can describe it to people and it's not too difficult to understand, and it's easy to see, how people have their services paid for and how they get into services and how their individual budgets are put together, and people can understand how the payment for services works. So we're also looking for it to be effective, which basically means the payment model supports people getting what they need and the appropriate services to meet their needs. Accountable means that the state can actually identify what people received and then relate that to what services were paid for. So we're trying to link up and make sure that we can say, okay, we paid a provider X amount of dollars, and we know that the individuals receiving services got the services that they were supposed to get, and they got what they needed. Administrable, we're trying to come up with something that's going to be not too burdensome for both the people in services, for the providers, and for the state to administer. This next slide, this is a kind of a visual of what we're trying to work on in the payment reform project. So we are doing everything, which is starting with figuring out how are people's needs assessed, what type of tool we might be using to assess what people need. Our hope is that we can come up with a tool that's will allow people who have similar needs across the state to actually get similar packages of services. And we have to figure out how are we going to evaluate that so that we have equitable distribution of our resources and funding. The second piece of that is the resource allocation, and which is basically how do we assess once a person's needs are assessed, how does that translate into how much funding becomes available to meet that person's needs? Then the third section is the payment model itself, and that's how will the state of Vermont pay the providers to provide the services. Currently, we use a situation where there are individualized budgets for every person, and those are based on a package of support that's been determined that a person needs various types of services, and then that's all added up together to come up with one individualized budget, and that's how it's working now. Service planning and delivery. So how will the actual plan of service be developed and implemented and then monitored, both by the agencies, by people in services, and by the state. And then accountability is regarding how do we actually track what's being provided to ensure that people's needs are being met, and also that the state is paying the right amount for services. I'm going to use this term encounter data as we go through this webinar. And encounter data basically means how much of an individual type of service did an individual person receive on any given day. So for example, like how many hours of service coordination did somebody get? How many hours of community support, or how many days of residential support did somebody get in a period of time? Those are things that are that we are going to be counting, and that's our encounter data. And why are we doing this payment reform? Well, there's a couple of different things that have come together to make the state realize a need for change in some of the ways we are running our business right now. And one was a state auditor's report, which basically said that the state needs to be able to more closely track payments and delivery of services. So that was a report that came out several years ago, and we have been working on trying to figure out how to do that over the last few years. The other impetus for this initiative is that there's a lot of efforts going on in the state to reform how healthcare is delivered to individuals, and the Agency of Human Services has a project around healthcare reform that is basically focused on trying to link healthcare and social services, because there's a lot of things that happen in people's lives that impact their health, and the goal of the healthcare reform is to try to enhance some of the and link and coordinate some of the human services and social services that have an impact on people's health. And so part of what we're doing is trying to figure out ways that we're going to align with those efforts. And the other major reason is the way we are actually authorizing and paying and monitoring services and keeping track of services for folks. This current system was designed several decades ago, like starting in the 80s into the 90s, and we really have not changed the way we've been doing this for quite a while. And back in the 80s, early 90s, there were maybe a few hundred people receiving services, and now we have more like 3,200 people receiving services. So it's become more and more complex, and so we're looking for potential for streamlining processes and making it more efficient. So all those things are coming together to make us want to do some payment reform. We have an agreement between the provider agencies and the Secretary of the Agency of Human Services, where we've agreed to move forward and reform some of the challenges that are in our system. So that's another piece of all of this. So I'm going to pause right there. I just gave you a bit of information about what we're doing in payment reform and why we're doing it. So we have 7 participants in the webinar. So if there's anybody who has a question at this point, go ahead and pose your question.
I have a question. It's Beth Masters.
Yep.
I just wonder if you could give me an example of a social service that would affect health.
Sure. So, one of the social services that can impact somebody's health is housing, for example. So, if people don't have stable housing and a steady place to live, they're not thinking about their health care. They're really focused on just survival, and they could be homeless or they could be bouncing from home to home, and so stable housing has been a big thing for allowing people to focus on their health once they have stable housing, and developmental disability services. We do provide residential services to people, and in addition to just housing, I mean, we do help people find housing and help link them to, like, for example, Section 8 housing vouchers so they can rent an apartment, but also providing actual residential placements, either in shared living provider homes or perhaps a group home, or staffing in an apartment. Those are some of the options that we have in residential services. In our service delivery system, that's also often paired with other supportive services. So someone would have a case manager or support staff to help make sure that people are following their doctor's recommendations, or making sure that helping a person make appointments with their doctor's offices, and making sure they follow through with it, going to appointments, and then ensuring that people then have access to their medications. So that's an example.
Great, thank you very much.
Okay. Are there other questions people have?
Yes, this is Steve Rao.
Yep.
I'm pleased to see you talking about the social determinants and reflecting that as part of a broader view of healthcare. Mm-hmm. But I sort of wonder whether we aren't missing an opportunity here. I noticed there are no representatives from the ACO, mm-hmm. OneCare, in this project. And it seems to me that integrating the designated agency programs with OneCare would ultimately be the best way to create a truly integrated, smooth functioning system. Mm-hmm. And that to some degree we're kind of preserving or even enhancing the kind of silo effect that has been in existence for years with developmental services. And I think, if you think about it, there are a lot of ways that the DS system makes very positive contributions to the performance on the healthcare side. In terms of the care model that we have for clients, that is far better than what any primary care practice might be able to offer their patients. And I just think we should try to think more broadly about how we do this. I mean, I'm quite supportive of the general idea and recognize a lot of the shortcomings in the current system, but I think we're missing an opportunity to view this as just a social service project and not view it in the broader context of healthcare.
Right. So you're making a really good point. The state is engaged with at the department level. The Developmental Disability Services Division is within the Department of Disability, Aging, and Independent Living, and there are specific things that are have been identified in the all-payer model, which is the big healthcare reform push, and that's the agreement that we have with the federal government around how we're going to manage our healthcare system. And in that agreement, we are noted as a long-term services and support system that needs to be coordinated with basically primary and acute medical care. And there are some conversations that are happening at the state level within the Agency of Human Services about how we're going to do that in the future. And so it's definitely still in the early stages, but those conversations are starting to happen now.
Thank you.
Yeah. Are there other questions from other people? Okay, we'll go ahead. So I just wanted to catch you up with what's happened to date. So we started meeting with a group of stakeholders in December of 2017, and the group that we brought together, it includes on the state side, there are representatives from the Developmental Services Division. There are individuals who are part of the department, which includes our deputy commissioner and we have a policy analyst and some folks from our business office. We also have support from the Department of Vermont Health Access. They are bringing their expertise from the Medicaid payment reform team to this project. And in addition to that, we have representatives from provider agencies, and we also have some representatives of people who receive services, advocacy organizations like Vermont Care Partners, the Green Mountain Self-Advocates, and we have some other parent representatives on the committee as well. So we have been meeting about once a month since December. We have developed a charter for the project. If anybody's interested in seeing the charter, I can send that to folks. If you just send me an email, I'll send you a copy of that. But the charter basically outlines what we're trying to achieve. We have evaluated how services are delivered. The services that are delivered are being reported to the state, and we've identified some current gaps in that process. We also initiated a provider rate study, and the purpose of that provider rate study was to determine the actual cost of delivering services. So we have a national expert in rate setting methodologies who's done this in about 14 other states around the country in developmental disability services. And so basically what happened is this organization has crafted and then sent out a survey to all of our 15 developmental services providers to ask them to identify like staffing ratios and other costs that go into delivering the various types of services that are provided by our provider agencies. And part of the impetus for that was that agencies that have identified that some of the rates that are currently used right now are too low for what it actually costs providers to provide services. And so this we're doing this rate study to try to really get narrowed down on what does it actually cost for providers. And so that actually has already happened. All the agencies have sent in their information, and now this contractor is analyzing the results, and then part of that, what comes out of that will help to inform how we design rates in the future. And then we also,
Claire,
yep,
this is Ed Giroux at Howard Center. I'm just curious, the contractor, is that Burns and Associates?
yes,
Okay. Thank you.
yep. So the next thing that we have done is we've taken a look at our current needs assessment process, and we've determined that we need to move to some type of more uniform and standardized needs assessment process. The current process that we have is basically something that we've developed internally in the state, and we're hoping to move to something that produces more uniform and reliable results. And so one of our work streams has been focusing on looking into how that's done in other states and other tools that might be available that we could consider to use, and exactly how that could be implemented in this state. That's one of the pieces that we're currently working on. Hold on for 1 second. Okay. The other thing that we're working on is we have created the internal work groups, and one is focused on the needs assessment. One has been focused on considering various payment models, and the third work group is the encounter data work group. And again, the encounter data work group is that's focused on how the agencies report back to the state what services have been provided to people. So we basically have gotten to a juncture where we really need to start diving in deeper into these 3 work streams to advance the work. And so rather than the state just working in isolation without the more stakeholder input, we decided that we need to now invite providers and other stakeholders into these work groups and work together to move the work of each of the work streams forward in an inclusive manner, and get as many thoughts and feedback and ideas from people who are impacted by the changes that we're considering. And that's where we sent out the invitation for all of you to join some of these work groups. So I'll stop right there. Do people have questions about this slide or the things that we've been working on to date? Okay, I guess I'll move to the next slide. So this is how we have just reorganized the work. So there's a state leadership team. That's the people who are working at the state from within the Department of Disabilities, Aging, and Independent Living, and the Department of Vermont Health Access Payment Reform team, who are kind of organizing all the work and are meeting intermittently to organize all of these various work groups that you see in the chart below. So we now have a reorganized statewide advisory committee, and then we have 3 work streams, which are the standardized assessment work group, the encounter data work group, and the payment model work group. So here, these are the people that we have on the statewide advisory committee. You can see that we have quite a number of state staff. We have some provider representatives. We have representatives from a number of the agencies. We have representatives from both designated agencies and specialized service agencies, which are smaller specialized agencies. We have a representative from Vermont Care Partners, and the Vermont Care Partners is it's basically the advocacy organization for the provider agencies. And then we have a representative from Transition 2, which Transition 2 is our supportive ISO, which is it's an organization that supports families and individuals who want to totally self-manage their services. And then we also have people who are representing people in services. And we have representatives from the DD Council, from Legal Aid, we have parents, and we have someone representing Green Mountain Self-Advocacy. That statewide advisory committee, they're going to be meeting every 6 weeks, and their role is to we hope that they will gather feedback from the people they represent, the people who are stakeholders, and both provide that feedback to the group and then also communicate out to people they represent so that people can stay up to speed on what's happening and provide feedback as decisions are being made. So their basic role is to give the state feedback and provide recommendations to the state leadership on any key decisions of the project. One thing I just want to mention about the meetings is all of these meetings, of all the work groups, they're all open meetings because basically all state meetings are open meetings. Anybody who is a non-member, they're not selected as a member, they can attend these meetings, but they just need to contact Lisa Perro to let her know that they want to attend. And so, because unfortunately I guess it depends if it's unfortunate or fortunate, but the Waterbury State Office Complex, where all these meetings are being held, it's a secure building and you have to go through security to get access to the building. So if you're going to be coming to the building, you have to call ahead to let people know that you're coming so that they can give you a badge. And some of the meetings that we're having we have basically a public space in the Sally Fox conference room where you just walk up from the lobby to those conference rooms. But some of the meetings are in an area where you need a state staff person to come and actually meet you in the lobby and take you beyond the doors that are secure, and your badges won't work for that. So for everybody who's coming to the meetings, you need to come to the meetings like 10 to 15 minutes before the start of the meeting so that you can check in with security and then also meet who's ever going to meet you in the lobby so that they can take you back to the meeting if it's not in one of the public meeting spaces in the Sally Fox area. Okay. So this is the standardized assessment work group membership, and we have some state people. We have representatives from 3 designated agencies, and we have a couple of parents and a recipient. And the next meeting for this work group is November 15th. You all should have received meeting invites going out to basically July for all of these meetings. So the standardized assessment work group, what they're focusing on is making a recommendation for a uniform standardized assessment tool for helping to determine what services a person needs. And so what they've been doing is researching what assessment tools are available that could potentially be used in the state. There's been a presentation on one particular tool that seems promising. There hasn't been a decision to adopt that tool, but we're investigating it. It's called the Supports Intensity Scale, or the CIS-A, and the A just stands for adult. It's a tool that can be used for people 16 and older. There is a CIS-C for children, which is for younger people who are younger than 16. We haven't delved into that at this point, but basically at this point we've had a presentation by the developers of this tool, which they are the American Association of Intellectual and Developmental Disabilities, and there was a presentation to the state team. We are planning a presentation for everyone in the state. Anyone can come and participate. It's actually not come, but it's a webinar, and that's scheduled for November 20th from 1 to 3. And you all should have received an invitation to hold the date and for that time. And then as soon as we get the link to the webinar, we'll send an update so that people can join the webinar and hear about that potential tool. The State Program Standing Committee, which is it's basically the advisory committee for developmental disability services. They've had a presentation on comparing the supports intensity scale to what we currently do, so that we can see the pros and cons of our current method and the possible adoption of this tool. And the future things that we need to look into also are we want to look at what other tools are out there that might be appropriate for Vermont to think about, and also, are there different pieces? Like if the tool is not sufficient in and of itself, are there other things we need to add to our process for doing a needs assessment? Also, we need to consider the cost implications of adopting any kind of new tool. So those are some of the things that the assessment work group will be working on, and that's basically brings you up to date on what's happening with the needs assessment work group. Are there any questions about that, especially from people who are going to be joining that work group?
Nope.
Okay. Okay, there's a payment model work group, and I am the lead on that, and we have other state people who are working in that work group as well. We have representatives from provider agencies, and we also have a representative from ARIS. And ARIS is the organization that it serves as the business office for our specialized services agency, so it was important to have their viewpoint in the payment model, because things are slightly different between what happens for designated agencies and specialized services agencies. And then we have some parents, and we have a representative from the ARC in Rutland. And the next meeting of that group is going to be on November 29th. So what the payment model is working on is figuring out exactly how we're going to pay for services in the future. So what has been done to date is, as I mentioned earlier, is we have initiated the provider rate study with Burns and Associates, and that the analysis is underway. For anybody, we're going to be sending out a hold the time for December 14th in the morning. It's a tentative date. I need to confirm with the presenter, but the person from Burns and Associates who's been working with us is going to provide a an overview of the results of that provider rate study for providers on the morning of December 14th. So I'll hold the date out real soon, and I might actually have the actual information for people to join. But that's going to be at the Waterbury State Office Complex, and Stephen Pulowski from Burns and Associates will be here. He'll be present at that meeting to provide the overview. The state is basically looking at what we call a straw model, which is just a shorthand for like an outline or a template of what we might want to use as the payment model moving forward. One of the things that the Department of Vermont Health Access has been talking about as a possible model are monthly payments to provider agencies. And the reason they're thinking about that as a potential model is that is something that aligns well with the accountable care organization's payment models in healthcare reform. So that's one idea that's we've been considering. And basically what's being explored is potentially the use of payment tiers, which is where the monthly payment to the provider is a certain amount of money that's based on like the range of services that somebody needs based on what their needs are. So, for example, the payment to an agency would be a lower monthly payment if someone has more minimal needs, and would be higher for people who have much more significant needs. And then, we don't know how many tiers there might be. It could be 5, it could be 7. How those tiers get constructed, those are all the things that the payment model work group is going to be trying to figure out. Or even if monthly payments that are tiered is even actually a viable option for the payment model. So again, there's a lot of things that are still being figured out, and that's going to be the work of this payment model work group. We haven't gotten very far on designing that yet, and this is certainly going to be one of the more complex tasks of this whole initiative that we're going to be working on. So basically what's been done to date is gathering some information from experts and examples from other states, and some research on how payment models are constructed in general. And those are the types of things that we're going to be reviewing, and then starting to dive in to figure out what will work best for our system. One of the things that we really are cognizant of is that we don't want to lose some of the very positive aspects of what we currently have, which are very individualized, flexible, person-centered ways of paying for services. And we have all that criteria in our mind about what the next payment model needs to preserve that are the positive aspects of our current system. We don't want to lose sight of those types of things. Are there any questions about that?
Claire, Steve Rao.
Mm-hmm.
I don't want to misinterpret this. Are we sort of moving away from the individual budget model, therefore, or is this just a kind of improvement on that process to correct some of the more obvious shortcomings?
So we haven't really decided exactly what the payment model is going to look like. So I don't know if people will absolutely still have an individualized plan of service. So there will definitely still be an agreement between the provider agency and a person that receives services and or their family or guardian that outlines what services they can expect to receive from an agency. We're definitely not moving away from that. But exactly like how the money will flow, that's still one of the things that we're going to have to figure out.
Okay. I'll stay tuned.
Okay. Other questions? Okay. Well, moving on to the encounter data work group. So we have state people and we have provider representatives. So actually, when we send out the invitation for people to join the work groups, for other stakeholders to join, like recipients or family members or advocacy organizations, we actually didn't get any takers who are interested in the encounter data work group. And when I thought about it, that totally makes sense, because essentially where the encounter data work group is at is that the state has decided that the agencies are going to be reporting their encounter data through this system, which is called the Medicaid Management Information System. And that's basically a system where Medicaid providers submit their bills for services, and in this case, they will still be submitting bills based on whatever payment method we decide on through the payment model. But in order to capture what services were actually delivered to individuals, they're also going to be submitting what's called encounter data, which is how many units of service did John Smith receive on November 6th, 2018, and but they won't be paid through that methodology. They will that will be their method of reporting what services were delivered to individuals on a specific date or a date range, and so really it makes sense that this is not something that really actually impacts people in services or families. It's really an impact and a work stream that needs to be worked out between the state and providers. So it makes sense that we don't have any people representing recipients on that work group, and so we decided that that's okay and that makes sense. So we'll keep people up to date and informed about what's happening there, but right now we're not going to have any additional stakeholders on that work group. So again, they're going to be that work group is going to be focused on identifying the billing codes that are going to be used to do that reporting. The state has a preliminary list, but we need to continue to work on that. We need a broader list of additional codes. The state is working with DXE Technology, though that's the state's contractor for processing billing. And so we're having some preliminary discussions with them about how this would work. And then the big lift of this work stream is that the provider agencies are going to have to figure out how they're going to be reporting services through this system. And it will, I'm sure, require agencies to do some software upgrades to their systems, and will likely require that they make some changes to how they collect and then report that information in this new system. So that's the big, it's not going to take the state a tremendous amount of effort to set up the system to receive the information, but we understand that for the provider agencies, this represents a significant change that they'll have to get ready for, and we don't know at this point how long that will take, and so that'll be the work that gets worked out in this Encounter Data work group between the providers in the state. All right. Are there any questions about that?
Hi, Claire. It's Sherry.
Mm-hmm.
I'm on the Encounter Data list. Can I get a copy of what the preliminary list is that's been identified? Just as an aside, equity is Friday. So I don't know that I've seen an invite or necessarily I'm aware of what time this work group is meeting.
Right.
Yes. Elena and I will both be at equity.
Right. So actually, I was going to talk to you guys tomorrow about the possibility of us. I figured that all the providers are probably going to want to be there. Is that a good guess?
Yeah.
Yeah. So I was going to ask at tomorrow's DS directors if maybe we could switch equity to Monday.
Or can we switch
Well, this guy comes from out of state, and so he unfortunately only has limited availability to us. And he flies in from Arizona. And
oh, okay. Do we know what time the meeting is?
Not yet. I'm waiting to get a confirmation back from him, but it will be in the morning, so it would overlap with
really his equity. Then.
Yeah. So I'd like to contemplate having equity on rescheduling it possibly to the following Monday.
That's a holiday.
It's in December.
Oh. This is November.
Right. So he's going to come in December.
Oh, I'm confused then. I thought the meeting was this Friday, 11/9. That's what I have.
Oh yeah, no, that's that. Yes, your Encounter Data work group is then. Yes. But the time when Stephen Pulowski is going to come and talk. Oh, I see what you're saying. I'm sorry.
Yeah, so we're at equity. I'm not sure what time. I'm sorry, you guys. Claire, we can have this conversation after if you want to keep moving.
Okay. I'm mixing up your meetings.
Yeah. It's this Friday. It's 11/9, and we're at equity.
Oh.
So, and Monday's a holiday, the 12th.
Oh, sorry. Okay. Yeah. We'll carry on after. Yeah. Okay.
All right, thank you. Sorry, guys.
All right. So basically, your role in the committee is to attend as many meetings as you can. I mean, I realize nobody can make every meeting. It's, I understand life happens, but you do have the option of participating by phone or in person. And again, all the meetings are at the Waterbury State Office Complex. If you're one of the things that will happen is Lisa Perro, she's my administrative assistant, she will send out an email before the meetings to confirm that you're actually coming to the complex, so that she'll be able to notify security that you're coming. So you should expect to get those emails from her, and if you could let her know quickly whether you're coming, so that we can make sure we have security notified. One of the problems that we've been experiencing in this initiative to date is that it really is a tremendous amount of work on the part of the state in terms of coordinating all these meetings. And there, as you can see, there's 4 different work groups, and we're coordinating 4 different sets of meetings. Like I said, the advisory committee only meets every 6 weeks, but the other work groups are scheduled to meet every twice a month. And so sometimes it's difficult for us to get the agendas out ahead of time, but whenever we can, we will send them out to the group ahead of the meeting. But again, sometimes we're really scrambling to get everything organized, in between the meetings. So sometimes you'll get the agenda right before the meeting, and we're sorry about that, but we will try our hardest to get any materials and agendas out in advance. There's sometimes you may be asked to review some materials ahead of meetings. and any of those would be, like I said, emailed out ahead of the meeting. We're asking that you serve as a representative of your group. So if you're a provider member, you can keep other providers informed about what's going on. We may ask you at times to seek input from others, like if you work for an organization, or if you're a family member or somebody who's receiving services, you may have contact with, other people may contact you, or you may reach out to other people that you know to ask their opinions about things and bring that back to the group. But basically, we're asked that you serve as a representative of people that you represent. And at the meetings themselves, you might be asked by the meeting facilitator to take on a role. I mean, these are volunteer roles, but to try to keep the meetings on track, we most likely have a timekeeper, an equalizer, which is a person who makes sure that everybody's having an opportunity to contribute to the conversation, and a jargon buster, because it's in state government, we just love to use acronyms and things that nobody outside of state government understands. So that's another role. And then the state people will facilitate the meetings. They'll collect the minutes, and they'll be basically the organizers of all these meetings. We hope that you will participate in the discussions, offer your opinions, share your ideas, make recommendations, ask lots of questions, hold the state accountable for sticking to the values that we state that we have around service delivery. So that's what we're hoping your role will be on the committee. Does anybody have any questions about that? Okay, and then I've already mentioned some of the logistics, but again, remembering Lisa will ask to confirm that whether you're coming in person, so we can let security know. When you go to security, you should have an ID. They don't always ask for it, but they sometimes do. If the name of the conference room that the meeting is in is either Oak, Cherry, or Ash, those 3 conference rooms are in the public area, and so you can just, after you get through security, you could just go ahead and walk upstairs to the conference room. And but if they're not in one of those 3 areas of those conference rooms, you're going to have to wait downstairs and a state staff will come and collect you and take you to the room where the meeting is being held. So you need to get there early, because the person who's going to collect the members, they're only going to come out once. We're not going to be able to come back and get people who are late, unfortunately, because there aren't a lot of people in these meetings, and we don't have somebody to go back and collect people that are late. So really make an effort to show up on time. Calling in is fine. If you look on your meeting invitations, the phone numbers to call in are listed on the meeting invite for each meeting. And if you are a person who's representing if you're a family member, a person who receives services, or you work for an organization and you're not participating in the meeting as part of your job, we will offer stipends and mileage. And I will make sure that the person who's coordinating the meetings has a copy of those expense forms, and we'll also I'll send them out electronically also, and you can send them back to me either in the mail or electronically, but I'll send more information about that as soon as I get a copy of the expense form. We'll send that out to folks. And then the other thing that we're going to do is have a section on our website. It's not up there yet, but it should be probably in the next couple of weeks. But on the Developmental Disability Services website, there'll be a section on our website where all the information about this project will be posted. So we'll post whenever possible. If we have the agendas in advance, we'll post the agendas, we'll post the meeting minutes, we'll post any materials for the meetings, we'll post the schedule of all the meetings and the call-in numbers for all the meetings will all be posted on the website. And as soon as the website is up and functional, we'll send out the link to that to everybody on these committees. So, are there any questions about anything?
Not that I can think of. I think you've covered everything quite well, and when we get into the details in the various subgroups, that'll probably be where it gets more interesting.
Right, exactly. So, feel free when you start on your work groups, feel free to, I think each work group as you join will be kind of trying to catch you up to where things are exactly, and then what your tasks are going to be in that work group. So you'll have an opportunity for asking some more questions about what's going on once you join the work groups. Okay, any other final questions? All right, great, and I appreciate everybody joining the webinar and also your participation in this important work that we're going to be doing moving forward. And again, thanks a lot.
Thank you, Claire.
Thank you, Claire.
Thank you.
Thank you.
All right.
All righty.
Thank you.
Bye.
Bye-bye.
Bye.